My name is Terje Eikemo. I'm a professor of sociology. Yes, sociologists work on health issues, so that's if you didn't know. And I lead a center that is called Center for Health Equity Analytics. And we are a center that is focusing on global health. So health is relevant all across the globe. So for that reason, we are global. And we focus on the social differences that are both the reasons and consequences of our health situation. Um, so we are monitoring these inequalities with the WHO, for example. We are explaining their causes, and we're also trying to find the right solutions to reduce health inequities. So those are the three pillars of chain. So chain is the short term of our center, and also in a few minutes Insa Backhaus will go through some of the results that we want to show from the make it healthy pillar. I'm not sure, Insa, if you want to say something now or if you want to introduce yourself once you start. I think you can say hello or something, and then
Yeah,
yeah.
maybe I do it now so I don't interrupt the presentation then. Yeah, I can only echo Terje's word. Really excited to be part of this really great project and yeah, to be involved in the Make It Healthy pillar. I am a postdoctoral fellow at Chain and I look primarily at health inequalities in Europe. That's why this project is so fitting to me. I do a lot of cross-country analysis and look at how yeah, health inequalities vary and which countries are most affected. And you will see soon that I look primarily into social factors, education, for example, but also working conditions and so on. And yeah, happy to present the findings of two of the reports that we have written as part of this project. And I give it back to Terje.
Yes, and just a few more words. I wanted to congratulate all of you who are here, and why is that? Well, first of all, this is the topic of today is of extreme importance. Health is the first resource we're given when we're born. It's a resource that we keep with us through our lives, and which both creates opportunities for us and restricts also access to services and to all our dreams. So it is so essential in our lives. And it is basically also a social divider. Those with better health are better able to obtain their dreams, and others not. So as social scientists, we usually look at health as something that points back to the social conditions from which we are raised, that we are born into, that we live through, and that we age in. Now, the second reason why I wanted to say how such a great idea for you to be here is that the data we are presenting today are quite unique. They are unique because they are recent. Sometimes it's you need to know the current situation in order to act, in order to understand what is going on. So they are recent, and they are also really widespread, meaning that we tap into different areas of society. From you will see today that we look into housing conditions, healthcare access, all of these kind of social areas of life that creates these opportunities for us that enables us to live long and healthy lives. We will also show you today that it makes sense to present data in an easy fashion. Sometimes we tend to use very advanced analytical tools to show how impressive our work is. But sometimes, it's enough to just present the data as they are, and that can provide really, really powerful messages. So today we are presenting data in a very descriptive way, and where so the main kind of issues we look at is age. We will look at education, if you live in a rural or urban area. So these kinds of information that we combine, and this provides stories that are kind of easy to tell. Now, the final reason why this is such a good idea, and that is something I'm also looking forward to, that's the next session when you are yourselves going to learn how to analyze the kind of data that we have been looking into today. I'm a lecturer myself, and I look forward to integrating the data we are presenting today in the teaching, because this is a gold mine for you to use. It's not just recent; it is really it taps into the areas that are of so high importance today. I'm not going to talk for much longer. This is the last slide here that you'll hear from me, just to show that there are substantial variations in access to central goods in Europe. There are differences in access to the social determinants that really leads to differences in how we feel. And why is that? So now I think Insa, it's about time that you take over. I will come back a little bit later, and when we are going to discuss what's next. So what should we do about this? And also look forward to hopefully a discussion with all of you. And I encourage you to write down the kind of questions you have, and that can promote a nice discussion afterwards. So Insa, over to you.
Yes, thank you. Thank you for the introduction, Terje. So when we talk about differences in health, one indicator that we can always look at in how a country does, or how Europe does, is we look at life expectancy. And what we can see here is that the life expectancy, even though the countries are quite developed or highly developed, varies substantially. We see the highest life expectancy in Italy and Sweden and Spain, and the lowest life expectancy, for example, in Bulgaria, Romania, and Latvia. And that despite the fact that everyone should have somewhat equal access to healthcare. So everyone should have the opportunity to live a healthy life and get the care they need. When in sociology we try to explain why we see differences in health, we often look at the social determinants of health, and we often use a framework that was published already more than 30 years ago by Dahlgren and Whitehead, which nicely shows that we have some non-modifiable factors which are at the center. These include age, birth, sex at birth, and genes, for example, which are surrounded by modifiable factors. These include, for example, individual lifestyle factors that are, for example, smoking and dietary habits, drinking habits. They are surrounded by social and community networks. So how well do you get along with your neighbors? How many friends do you have? What does your social capital look like? And these are again surrounded by wider living and working conditions, your education, the work environment, but also healthcare services, housing conditions, and unemployment. And these are essentially conditioned by the general socioeconomic, cultural, environmental conditions. So how politics shape basically the living and working conditions, the social and community networks, and the individual lifestyle factors. And the social determinants of health, and that's what the framework shows, are therefore the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. And this is not a definition of myself. This comes from the World Health Organization. And like I said, we use this framework and even more complicated frameworks to investigate why we see differences in health across Europe or across the globe. And this framework also guided our research for the Infra for Next Gen project, for which we published two reports. One is the data summary, and one is the top-line report. In the data summary on the left side, we use data from various sources, such as the European Social Survey, the ISSP, whereas in the top-line report, we primarily use data from Kronos, which is a sub-survey from the European Social Survey. I will present today some findings of both reports. Like Terje said, these are descriptive. We did not do complicated logistic regression analysis or multi-level analysis. We primarily wanted to look at differences in health in a descriptive way. And these reports are also available on the Intra4 NextGen website. And I will not talk a lot about the data sources because David will give a presentation on that, but just to give you a brief overview, these are the sources that we use. The European Social Survey. The European Social Survey is conducted every 2 years since 2002. So it offers a lot of data on social topics, and we include always a health module every 7 years, I guess, but it also includes a general health questions, which we were able to analyze. Then we have Pronos, which is a sub-survey. It's a panel survey of the European Social Survey. We use the European Quality of Life Survey and the ISSP, the International Social Survey Program. And I want to talk about two health outcomes today. The first one is self-rated health, and the other one is mental health. Mental health was particularly measured in Kronos, where self-rated health will always refer to the European Social Survey. And I also would like to look at health behavior. And because I'm not able to cover all determinants that were included in the framework, I picked particular or examples of social determinants, and this includes, for example, social support and housing conditions. And I would like to start with self-rated health and health-related behavior. Using data from the ISSP, we found that overall the European population is doing okay. Europeans aged 15 to 34 overall reported better health than their older peers. This is good because sometimes we see that especially the younger generation doesn't have a good health anymore compared to the older generation, and that for university students, for example, the health is decreasing. But in the ISSP from 2021, we actually found that young Europeans are doing okay. However, we still see that around 14% of men and 15% of young women describe their health as poor or fair, so still a substantial number that doesn't live in good health. And I want to say that our reports focus primarily on young people, always in comparison to older people, but you will hear a lot from me about the younger generation in Europe. We do see notable differences by country. Again, this is data from the ISSP 2021, and we see that Hungary and Czech and Slovakia report the lowest rates of fair or poor rated health. This often at the first glance comes as a surprise, but this is actually a finding that we see a lot when we look at self-rated health. This is often due to cultural factors. We also see that, for example, Italy doesn't have a lot of people that report their health as poor or fair because these populations often tend to rate their health a bit better than it actually is. And we do see that, for example, in Denmark and France and Norway, the population usually reports their health as poor compared to the other countries. We also see a lot of differences in self-rated health by education. And this is one of the most important, maybe, social determinants of life. Education predicts health literacy. It predicts your earning incomes and your job opportunities in later life. So it's a very important determinant, and we always look at education when we look and differences in health. And we see that the lower educated groups usually report poorer health across all age groups, which you can see on the left, and across all gender, both male and female. Those with lower educational levels report poorer health compared to those with medium and higher education. We also see differences in health-related behavior, but unlike self-rated health, we actually see that it's more favorable for the younger generation. We see that daily smokers is actually quite low in, I don't want to say quite low, but it's lower than in the age group 35 to 54. So younger people smoke less. This we can see for both male and females that people aged 15 to 34 have lower smoking rates than those aged 35 to 54. We also see not a similar trend, but yeah, we see that alcohol consumption is lower in the younger generations, but only for males. The female younger generation, 15 to 34, is shown on the lower bottom, actually drinks more than females aged 35 to 54. And coming to the next important measure of health in Europe, and that is mental health. And mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. And again, this definition doesn't come from me, it comes from the WHO. And based on this definition, we included a question in the Chronos survey, the sub-survey of the European Social Survey, where we measured how the self-rated or subjective mental health is in young people in Europe. And we did so by asking respondents to rate their mental health on a scale from 1 to 5, with poor to with very good or very bad to very good. I have to say first that this is not a measurement of depressive symptoms. This was a fairly new item that we wanted to try and include. So this is really subjective mental health. We did not use a depression scale to measure depressive symptoms like the WHO 5 well-being index, but yeah, we measured subjective mental well-being. And that's why maybe when you come across other reports, you will see that the prevalence of depressive symptoms is much higher than what we report here. Anyhow, we found that among the Chronos respondents, nearly 7% reported bad or very bad mental health, and that the prevalence again varied substantially between countries, with respondents in the United Kingdom, Hungary, and Iceland reporting the highest proportions of poor mental health. We also see again differences by socio-demographic factor and especially by education. It is shown on the lower bottom, and we can see that those with a lower education were more likely to report poorer mental health compared to those in the higher educated groups. Compared to medium education and high education, those in the lower education, it's more than 30% that reported their mental health as fair to very bad. We also see differences by age, with younger people substantially more likely to report poorer mental health compared to those over 35. And we see differences by gender, with females more likely to report poorer mental health. This is a common finding. Females are usually more likely to confess that they struggle with their mental health compared to men. And it's also a common finding now that younger people rate their mental health poorer than older people. We looked at determinants that might be associated with mental health, and one that is particularly important is social support. And we can see that among those who received support, 94% reported good mental health, whereas 85.6% did not. So social support is an important factor that should be considered when we talk about interventions, and especially digitalization and isolation, that maybe we should increase again participating in community networks and increasing social support and social networks. And another very important topic that came up during the report and also to some of the presentations that we did, and that is loneliness. We used data from Kronos again to look at loneliness, and here the question was, have you felt lonely during the past week? And we found that 39% of respondents felt lonely during most parts of the week, and that young adults are overall lonelier than older adults. We can see in the figure on the right that around 52% feel at least moderately lonely, compared to 35% of older adults feeling lonely. And we again see differences by country, with respondents from Hungary reporting particularly high levels of loneliness, followed by Czechia and France, and lowest rates in Finland and Austria. So again, significant country differences that deserve further investigation of why people feel particularly lonely in Hungary, for example. We also looked at the association between loneliness and mental health, and we found that respondents who reported feeling lonely were more likely to report poor mental health. We see this across the different surveys. Here we used Kronos data again, but if you use other social surveys, we also see a link between loneliness and mental health. And another very important determinant is healthcare access. And in our reports, we looked at general healthcare access, and we looked using Kronos data again at healthcare access for mental health. And this figure shows data from the European Social Survey, from the 11th round of the European Social Surveys. And here respondents were asked if they experienced unmet medical needs in the last 12 months. And we have looked at this by gender and age. And we can see that younger adults were more likely to report unmet medical needs compared to older adults. We also see differences by gender, with females overall more likely to report unmet needs compared to males, and that we see for all age groups. We see similar patterns for mental health here. Again, we use the sub-survey of the European Social Survey, and we see significant differences by the socio-demographic factors. Younger people overall report higher rates of unmet mental health care need compared to older adults. Again, females have higher unmet health care needs, and again, those with a low education have higher unmet healthcare needs compared to those with higher education. We also see that, and this is again referring to general medical needs, unmet needs, is that women living in urban areas are more likely to report being unable to access care in the past year compared to men in urban areas. And one of our explanations is, for example, that in urban areas, and actually I thought this was surprising. I thought maybe the rural areas suffer more from unmet healthcare needs because it's more difficult maybe to get to the doctors. Especially in Germany, we see that there are not a lot of doctors' offices anymore in the rural areas. So I was surprised to see that it's actually the opposite, and people in urban areas are more likely to report unmet healthcare needs. But we think that this could be due to a greater demand in urban healthcare systems, and also potentially differing expectations and thresholds for seeking care. That in urban areas, especially young people are more likely to seek care, but then are faced with challenges to access the healthcare they need. But still, I think these results are very interesting and also deserve further investigation. And then another determinant that we barely discuss when we look at differences in health, or in general when we look at the social determinants of health, is housing problems. And first of all, it's important to say that adequate and safe housing is a key, what we call material determinant of health. We experienced it especially during the COVID-19 pandemic, that people in I don't want to say unsafe housing, but in that were crowded in houses had higher prevalence or higher incidence rates of developing COVID-19, whereas people in safe housing were able to to separate more, and so on. And we see that in the younger population, housing problems are pretty widespread, and we see this for both men and women. And we see this, yeah, it's quite clear that younger generations have more challenges in accessing safe housing. And with that, we mean, for example, rotten windows or damp walls, and so damp apartments, leaking roofs, flushing toilets, overcrowding, or non-functioning heating. And I recently came across a report from Germany that showed that especially university students suffer from poor housing, especially when it comes to their student housing. So this is an interesting finding, I think, looking at housing problems among the younger generation. And we know the rent market everywhere in Europe became extremely difficult for the younger generation. And we see again that the share of young adults facing housing problems varies widely across Europe. We see Croatia, Greece, and Italy at the lowest end, and the highest end are Germany, Iceland, and Belgium. We also see that Europeans in urban areas face difficulties, and like I already mentioned, we think that this may be due to unaffordable rental markets, especially in big cities. In Germany, for example, it became extremely difficult to pay for housing, but also less stable living arrangements, moving between towns, changing relationships, and so on, finishing your studies or your education, then having to move again and find new housing. And that was it from the reports. The reports are very lengthy, and we have done a lot of analysis also on the other social determinants of health. And I invite you to read them, and also to go a bit more on the reasoning of why we found certain findings, and yeah, to see what other differences and so in the social determinants across Europe we found, and in the health indicators. And now I give it back to Terje.
Thank you. And of course, this story that you just told us is quite concerning in some ways. I think that one of the key takeaways is that the new social divide in Europe is perhaps not our social status, education, or what we traditionally think of as the main dividers. I think the new divider is the generation gap. When you look at loneliness, for example, we see that the younger are more lonely than the older generations, and not to speak about mental health, where we also see this generation divide. So I think that's extremely concerning. I think we have also a slide here with some key takeaways, so you can also take note of them. So overall, we do see that most Europeans report good health, but I think that as long as there is a share of those who are not feeling well, then that's already concerning. And then again, we see that there are variations in who these people are. We have looked at some of the determinants, so basically the factors that explain these variations. And in this presentation, we have looked at social support, we have looked at housing conditions, we have looked at financial strain, and healthcare access. There are others. These were some of the, I think, most striking determinants that we've looked at during this project. And the fact that it's the younger generation that is at risk is just completely unacceptable, because usually, when we are young, we haven't really accumulated all the experiences that makes our health get worse, deteriorate, right? So we should expect that it's really at younger ages when we excel, but in this situation, it's not. For mental health, for loneliness, and that's very concerning. And we need to understand the mechanisms and the tools to deal with this. I was just looking at one of the results from Finland, for example, that the lower levels of loneliness in Finland, and that just reminds me of the stories we get every year that the Finns are the happiest in Europe. So now we can start seeing the connection. So this is one example of a project that one of the, if you're a student here listening, that you can look into using our data. We have also looked at behavior patterns, so smoking, alcohol consumption, diet, and BMI. These are usually referred to as the big four. And these patterns are themselves mixed, and they also help explain the broader the findings that we see. But they are in turn influenced by the wider socioeconomic conditions in which we live. So one of the typical advices that some people give to the younger generation might be stop drinking, stop smoking, start behaving. But basically, in the end, it's the conditions in which they live. It's their housing conditions. It's the healthcare access. It's the financial situation that in turn affects behavior. So that's why we need to look beyond behavior alone. Is there another slide here with conclusions? At least there is one more thing I wanted to mention before we start the discussion. Yes. So this is my kind of my last message for you. So this is a new project. It's not part of the Infra for Next Gen project, but it is a policy implication of the Infra for Next Gen project. So it does relate strongly. Because what we've seen today is that we have a new generation now that is growing up that we need to take care of because we see some really disturbing tendencies. And we don't only need better policies. We also sometimes we need better data, or not just better data. We need data where data previously did not exist. And one of the, this might surprise you because we do have data sources that is looking at the adult population. So European Social Survey, like 15-year-old or 18-year-old plus, kind of focusing on the working age and even into older age. We have the SHARE data, which looks at people who are older than 50. So we have all these surveys that are comparing countries at different life stages, but there is no single survey in Europe that is focusing on children and on children growing up. So when we are looking basically at the situation today and trying to explain why the younger are feeling as they are, why they are lonely and why they struggle with mental health issues, of course, you should start earlier on and see what is going on while they're growing up in different countries. So this is what the guide study will do. And what I'm going to say about that is that it has not started, but it was an initiative by the European Commission already more than 10 years ago. They wanted to find out, is it possible to follow up children in Europe in a cross national way, in a comparative way, and in a longitudinal way. So since 2016, the European Commission has sponsored, I think, 5 or 6 projects. There's even a new Horizon project that was recently funded, Guide Prep 2, which is now preparing a guide for implementation. And indeed, there is a study called "Growing Up in Ireland." There are studies in separate countries, but there is no harmonized one. But actually, the study is coordinated from Ireland. and from the UK. So Ireland is a key country that is really driving this change, I'd say. So Sinead Sloan from the School of Education, University College Dublin, she's co-leading this with Gary Pollock from Manchester Metropolitan University. And my role in this is basically to secure funding in Norway, because now we are researchers all over Europe trying to find funding for this study. It's going to be extremely expensive within each country, but we just have to do it. Sometimes it's just too important. And I think the Infra Foreign Exchange project has shown how important it is to focus on the younger generation now to understand what it means to grow up. What does neighborhoods mean? School, family. On the next slide, you'd see some. Please, if the this shows that it's designed by children themselves and policymakers and scientists. But a couple of more slides. Let's see, one more. Here are the questions. So we ask about the same things that we ask in the Infra Foreign Exchange project. So about psychological well-being, neighborhoods, schools, material conditions, activities, and we also ask their parents. So on the very last slide, let's see, one more, two, there, yeah, this is the last one. This is the last one. We are going to start in 2028. We are going to follow up 5,000 newborns and 4,000 eight-year-olds in the smaller countries, and double the sample size in the bigger countries, and follow them up until 2056. So you can imagine this is a huge study. And one of the main things we will look at is the digital environment in which children are growing up. And the digital environment is also very important in the Infra Foreign Exchange project. And what we have seen from the Infra Foreign Exchange project is that there is a relationship between usage of social media devices and how young people are experiencing bullying online and how their mental health situation is. And this is another idea for a project. So I think that the Infra Foreign Exchange project has been really innovative in this respect. But we need to understand how it is to grow up from the beginning, and what cross-national evidence is enabling us to do is to compare countries where social media is banned until a certain age with other countries. And we can also look at natural experiments, because some countries are banning now as we go, and we can see if this will change the situation. So guide study is the next big thing, and I would encourage everyone here to check if who is coordinating guide in your country, and please support them, because this is something as a researchers we just invest time in. It's just too important to ignore, and it's really the Infra Foreign Exchange project that has increased the relevance of such a study, and an important policy implication of the Infra Foreign Exchange project. So that's my final policy message.